The cardiac system is and will always be the meat of the NCLEX. There are plenty of ways to study the cardiovascular system, but the best approach is to break down the different major diseases in a way that you can understand and remember it better. First, I want to go over what I call the big three cardiac diseases, aka the Big Mac. What I did is I did a very simple case study in which I asked 25 fresh nursing graduates, basically students that just graduated nursing school and they're now about to take the NCLEX. And I asked all of them a very simple question, which is, what three main cardiac diseases that they think they will encounter and will be asked upon in the NCLEX exam. And 75% of the answers that I got included angina, myocardial infarction, and CHF, which is heart failure. I then asked several students who have recently taken the NCLEX if they remembered the cardiac diseases that they encountered more often during the exam. And the results came out to be very similar, in which the majority mentioned that angina, myocardial infarction, and CHF or heart failure were the biggest three main cardiac diseases that they did encounter in the exam. Now, the second category involves the valvular diseases. When we say valvular disease, we are talking about the heart valves within the heart that has problems with opening or closing. That's basically it. Going back to the anatomy of the heart, we all know that the heart has several valves, right? Remember, we have the mitral valve, the tricuspid valve, we have the aortic valve, and we have the pulmonic valve. But with the valvular diseases, we're only going to focus on two particular valves, and this involves the mitral and the aortic, and the problems that it has with opening or closing. So let's say there's a thickening of the valvular tissue within the mitral valve, and it causes the narrowing of the valve opening, then we can say that it's stenosed, or either fully or partially closed, right? And we call this valvular disease mitral stenosis. On the other hand, if the flaps of the valve are weak and floppy and doesn't close tightly, then these flaps normally would not be able to seal the valve properly, and we call this problem a mitral valve prolapse. Now, if for some reason the valves doesn't close completely or is partially insufficient in closing, we can therefore call this valvular disease an insufficiency, so we call it a mitral valve insufficiency. And the same things can apply for the aortic valve. The aortic valve could also have a stenosis or an aortic insufficiency. To sum this up, we can basically simplify valvular heart diseases by looking at the two particular valves that is involved, which is the mitral and the aortic, and we'll look at the problems that involves the opening and closing of these valves. Lastly, we can look at the inflammatory diseases that affects the heart. And usually, this inflammation usually affects the layers that lines up the chambers and the valves of the heart. And these layers includes the pericardium, the myocardium, and the endocardium. And all of these three disease inflammation is usually caused by either a viral or a bacterial infection.